who have they passed it to since, isolating those people. It then has some degree of mitigation methods like mask use and distancing to continue until you haven't got any outbreaks for a period, when you've got zero COVID, zero community transmission, and then you can move back into normal with ongoing measures at borders or other travel kind of restrictions, including quarantine. The benefits of these kinds of strategies is that are manifold. So it's been achieved in other countries and with other diseases. It creates a much lower death toll and also a lower morbidity toll. You get life back to near normal quite quickly, and there's a lower chance of mutation of the virus and vaccine escape or increased transmissibility, which increases your immunity threshold for vaccines. Okay, so currently we're at suppression/mitigation, and SAGE think that on that background, let me just stop sharing because I don't think we need it anymore. Or pause share, or stop share. Okay. That we're going to get to 150,000 deaths, even at the most optimistic. We already have 3 variants in the UK with escape mutations, particularly the E484K escape mutation. So we have very, very limited other options if we want to reduce death toll and morbidity. If we had adopted this strategy much earlier, at the kind of time period that perhaps Australia was, in summer, the UK and Australia had a similar kind of rate of COVID infection, or precedence of COVID infection. And Australia introduced an elimination strategy and are now have had very, very few deaths. And since then, we've had another 70,000 deaths, plus in the second and third waves in this country, plus of course, all of the associated disability that comes with people who survive it. Not just long COVID, but a 12-fold increased risk of stroke, a 10-fold increased risk of diabetes, and all of the other morbidity outcomes that end up with that. And of course, we've had several more lockdowns. So instead of moving back towards our normal life, we've had recurrent lockdowns impacting on people's work lives, social lives, and so on. In prep for this, I've done some reading of some of the stuff that you've put out about COVID and the things that you are suggesting that we do, which is good. So in Solidarity from the 3rd of February, the Labour movement cannot second guess the scientists. We can and must campaign for social measures needed to make lockdowns and COVID distancing effective and to minimise their social costs. Full isolation pay for all, bringing social care into the public sector, workers' control of workplace safety, publicly provided quarantine accommodation for the self-isolating and people entering countries, maintained and better furlough for all. And that's in the editorial from, as I said, 3rd of February. We would agree with all of that. I think there's been quite a lot of confusion over what zero COVID is in the UK, or the zero COVID campaign, and some of the stuff that I've read. So there was a characterisation in stuff you wrote in November as being an SWP grouping, which isn't true. Kind of early zero COVID meetings might well have had SWP members in, I'm not completely certain, but mainly was surrounding Manchester Trades Council and the Hazards campaign. So there were BMA activists there of many political persuasions and none, people from the Labour Left Unity, People's Assembly, Unison Health activists and others. We've also been characterised as being pro-police, which is not true. In fact, even on our founding statement, if I come back to sharing our screen, if I can tab. So we put social solidarity instead of crude police enforcement. Okay, we're quite clear about the racist and ineffective ways that police enforcement can be used. I'll stop sharing again. Quite the opposite. The cooperation with COVID preventing measures rely on support and social solidarity and good explanations, not on policing. I think there are some places where we would improve state power. So the HSE has been very, very poor throughout this pandemic, and we'd certainly like to see more powers for them. It's also been said that we see no role for the labour movement. And I think quite the opposite. We think that the fight for lives and livelihoods can only be won by an empowered labour movement, and the actions of the labour movement forcing the hand of the government, but also employers, many of whom are still bringing workers into the workplaces in DVLA, in Jaguar Land Rover, in Halewood and other places. And action by the labour movement is needed, both to mitigate harm where you have to be in work, but also to get people home, and then to push for the measures that we need to make the zero COVID strategy possible. There's also a kind of idea that we want endless lockdown, indefinite lockdown, or that we're kind of skating over the harms of that. I'd like to say that we're not advocating for zero COVID because of some love of lockdowns. We extend the idea that this lockdown should be longer, or any lockdown that you're currently in, on the basis that we don't want more lockdowns in the future. We want things to be back to normal. So we accept some degree of sacrifice in the short term to get to a position in the long term where you can see friends, lovers, families again without the risk of giving them COVID and killing them, as has happened for many over Christmas. We were characterised in one of your articles as amateur epidemiologists, which I thought was very funny, as a person who brought public health professionals and epidemiologists to the opening meeting of Zero COVID. So we have some of us who are genuine professional epidemiologists, plus working with Ice Age and hazards and others, and then some of us with no kind of public health expertise, but expertise in other areas. So yeah, we don't want indefinite lockdown, etc. Okay. I hope that we can have a chat today about the things that we agree on, because there's lots that we agree on, but also perhaps tease out anything that we disagree on. I'm not sure that there'll be a great deal that we disagree on, actually, if we get to the crux of it. But if we can find some things that we think we should be doing, that we agree that we think we should be doing, I think there's lots of crossover with the safe and equal stuff and what the labour movement more generally should be doing. And I'm looking forward to the discussion. Thanks.
Thanks very much for that, Emma. So Martin, you're next. Over to you.
Okay. Thanks, Emma. So as Emma quoted, we don't think we can second guess the scientists about the science of the pandemic. We do try to educate ourselves in the science. We try to make intelligent judgments and comments where the scientific opinion is divided, as it often is, but we understand our limits. And that's why in the pandemic, we've focused on arguing for the labour movement to fight for social measures, which, so far as we can understand the science, are good for making government measures like lockdowns work well, and good also to offset the social costs of those government and police measures like lockdowns. The underlying idea here is that combating the pandemic requires mutual aid, each of us helping to reduce the risk of us infecting the next person. And Kropotkin used mutual aid more or less as a synonym for socialism. The more social solidarity we can win or defend through measures of social equality, of mutual trust, of social provision, the more easy and probable it will be for people to help each other on a large scale. For example, lockdowns with full isolation pay and quarantine accommodation for people who would otherwise be trying to self-isolate in crowded housing work better and have fewer social downsides than lockdowns without those things. And if the labour movement doesn't fight for that isolation pay, it won't happen. You know, plenty of very right-wing governments have imposed lockdowns. It takes the pressure of the labour movement to win things like isolation pay. So we've been campaigning for pretty much a year now for full isolation pay, and with some victories. And for the other social measures, which some of which Emma's mentioned, for the requisitioning or emergency public ownership of industry and resources like private healthcare, resources for the production and distribution of PPE, and now especially of big pharma, of the patents and intellectual property and the production infrastructure of the big pharmaceutical corporations. So that these things become public resources, mutual resources, for bringing social care into the public sector with care workers on the same sort of paying conditions as directly employed NHS workers with union agreements, for public health test and trace, and for works control, workplace safety. So, as Emma said, zero COVID statements strongly suggest support for full isolation pay, and that's good. And Safe and Equal has been campaigning for that for a while, and has made recently a call for a united front on that, and I hope we can work together on that. What concerns us and what we want to debate is that most of those other social measures aren't in zero COVID statements. For example, there's no actual call for workers' control. There is a call for workers to be fully involved in workplace safety, which I guess is meant as a hint, but I don't think a hint is enough on that sort of thing. I mean, you must have had experience of work of the management saying they want you to be fully involved in something. It isn't the same as workers' control. I think there is an exaggerated and unrealistic reliance on lockdowns, on policing as the answer. And just to say, the headline demand in the statement and in what Emma says is that we want the government to do a maximum strength lockdown to keep it on until the infection rate has gone to zero or near zero, and then the problem will be fixed. And I have 5 worries about that focus. First, it just won't work in its own terms. Zero COVID says it's been done in other countries, but in fact, what they propose has been done nowhere. And the evidence from across the world suggests to me their scheme just wouldn't work. Secondly, that it relies on the idea that 100% lockdowns are the only ones that work. So there's no room in the scheme for eased lockdowns, which could enforce still a lot of COVID distancing, but allow at least a limited amount of people socializing. Third, that it doesn't take sufficient account, I think, of the downsides and costs of lockdowns. Fourthly, that it takes no account of the changes introduced by the arrival of vaccines. And fifthly, that despite what Emma said, I'm sure that it's not the intention to eliminate or marginalise the labour movement as a factor, but it seems to me that focus on lockdowns cannot but do that. Okay. Right, before I go into that, it's not at all that we're against all lockdowns. Lockdowns are a very old, very crude, very clumsy way of dealing with infectious diseases. But the evidence since early 2020 is they can work up to a point and given certain conditions. The trouble is that the up to a point and certain conditions are quite big factors. I would say here, we were against the easing of the lockdown in July and August. We were against that. And it is possible that if that hadn't been done, the downward trend, which you had until the beginning of July, would have continued and brought us down to a much lower level. We were against that. And, we're in favour of continuing the present lockdown until rates are very seriously reduced. Okay. So it's not that we're not anti-lockdowners, but there are those 5 points. Firstly, will the lockdown, lockdown, then you get to zero in all clear. Will it work in its own terms? Well, as I said, none of the countries which zero COVID cites as a model has actually done that. There is a common factor in the countries they cite, and that is that they are remote islands or countries which have land borders which are very heavily policed and not crossed much. So New Zealand, Australia, Taiwan, South Korea, they all have had and are continuing effectively closed borders. And there are other countries which have had relatively low tolls for the same reason. You might say, well, Cuba has a low toll like those because it's a model of public health, but it's hard to believe that Haiti or Mauritius or Barbados or Madagascar, where the government has promoted herbal tea as the answer to the virus, are modeled similarly. Why have they all got low tolls? Because they're islands and remote islands where, there's no tunnel connecting them to the next country. Of all the richer countries, Japan is the one where the population most disapproves of its government's policies in the pandemic. And I tend to sympathize with the government rather than the people, rather than the government. But it has a lower toll than anywhere in Europe. Why? Not because of excellent government policies, but because it's an island country with closed borders. That is the common factor. Tight lockdowns aren't. New Zealand did have a relatively tight lockdown for 4 weeks last spring. It didn't start that lockdown with the aim of zero COVID. It started it for the same reason as the Tories here had started the lockdown a few days earlier, and with the same perspective, that it was the only thing the government could think of to reduce the risks of the hospitals being swamped. And New Zealand is even shorter of intensive care capacity than Britain is. So they were more worried about being swamped. There was nothing special about the New Zealand lockdown where it started, essentially. The thing that was special is it worked much better than the government had expected, rather than working much worse, as the lockdown did here. And that's probably because the virus arrived relatively late in New Zealand and they closed the borders, and they could keep them closed because it's their islands. Even then, New Zealand didn't actually do what zero COVID recommends. They didn't keep the tight lockdown until they got to zero. They aren't at zero now. They do have a low level. They have had 2 lockdowns since then. Australia had a looser lockdown than Britain in spring 2020, didn't push it through to zero. They've had 5 further lockdowns in various states since then, one of them quite long because of leaks from their quarantine system. Still, their figures are much better than Europe because of the closed borders, not because of a special skill with lockdowns. Their figures will rise again when they reopen their borders. Maybe, I guess they plausibly hope that a year or 2 will reduce world levels enough that they can make that new rise manageable. And that may be the case. But they haven't got life back to normal. They will eventually have to do something which will raise their rates again. I'm not saying what they've done is wrong for a remote island, but it's based on being a remote island. It's not, Taiwan and South Korea haven't had lockdowns across the country at all. They haven't got zero COVID either. So in early January, for example, South Korea had 4 times the level of COVID deaths of its peak in spring last year. It was still a lot lower than Europe, and that's because of the closed borders. I know of one country which has imposed a strict lockdown, just said, we're going to keep this on as long as it takes. That's Argentina. Argentina had a relatively low toll last spring when they started the lockdown, but for some reason, I suspect basically because of the social factors which made the lockdown ineffective, their toll just kept on going up until at last they saw some signs of a decrease in late October. And by then, right along, no one had the will to continue a lockdown for 6 months longer, or a year longer, or however long it would take. So it's not right. What zero COVID has not been done anywhere else. Things have been done elsewhere in the world with very good results, but they're not. They're different things, basically. I do have a worry also about the idea that lockdowns have to be absolutely full on, or at least theoretically full on, to work. Let's look at how strict lockdowns were in Western Europe across countries where social conditions are fairly comparable at their height around the end of March 2020. This is the order from strict to loose. Strictest is Italy, then France, then Spain, Belgium, the UK, Netherlands, Norway, Germany, Denmark, Finland is the loosest. So the correlation is roughly the stricter the lockdown, the worse the toll. no, it's not. I don't think the strict lockdowns caused the worst tolls. I think the worst tolls caused the strict lockdowns because the governments there felt under greater pressure to, do something drastic. They were more worried about their health systems being overwhelmed. But if you look at it, it's not the case that the stricter lockdowns brought quicker drops of infection. And when the lockdowns were eased a bit, not as they were in summer, but they were eased a bit from early April. So primary schools reopened in Denmark, for example, the infection curves kept going down. They started going up in Europe after the schools closed in July, and the tourist industries and the cafes and the bars and the pubs got busy again. So it's not the case that it's absolutely full lockdown for as long as it takes or nothing. Just one thing on, Emma says if you had absolutely full lockdown here, it would take 2 or 3 months. I doubt it.
That's what I said, current R rate, sorry.
Well, yeah, if that's accurate and so on. But for example, Australia, they had in Victoria a new surge back from last June. Right, at the height of that, the number of active cases was 4% of what we have, put in proportion to population, was 4% of what we have here. It was 25 times smaller. It took 4 months of full lockdown to get that to zero. Now, I don't know, it wouldn't necessarily be 25 times 4 months, which is 4 years here, but the idea that you can get down a 25 times higher level quicker than you can get down a 25 times smaller level. I wish it were true, but it's not what they found. And that's with, social conditions in many ways a lot more favourable in Australia. You have a lot less crowded housing, lots of other things. What about borders? Now, we in Works Liberty have said we're against closing borders as New Zealand and Taiwan and Australia have done. We're against it even where it's logistically possible, which it is for those countries. But we do want quarantining at borders. New Zealand and Australia have quarantining, but they also have rules that you can't get in. You can't even get into quarantine unless you're a citizen or a resident, or of course, a big shot foreign investor, a tennis star, something like that. Now, we're against those sort of rules, but we're for quarantining. Now, I don't want to be glib. There is a real problem here. The quarantining we call for can't work unless movement is reduced a huge amount. If Britain had even half the usual number of people coming into this country each day and 10 days quarantine, then we would need a quarantine city of about 4 million residents and staff. You have to build a new city of 4 million people. And, well, you're not going to build that in lockdown and in a short time. So basically, you have other measures to deter people from coming in. We recognise, so what we're proposing is not costless, it's not harm-free, and it's not perfect either, because Britain has 10,000 truck drivers coming in each day. New Zealand obviously has 0, always has 0. And I don't know how you could quarantine all the drivers for 10 days without making it impossible for even the most essential parts of social life to function. So we don't have a perfect answer. What worries me about zero COVID in this respect is, on the one hand, its pitch is that we should copy the countries with closed borders. And actually, it says very little about borders. It says in the statement that people coming in should be screened, presumably with lateral flow tests, which give quick results, and then quarantined where necessary, presumably when they test positive. So that might become workable if the lateral flow tests get very much better. But as it is, with even a fraction of normal traffic, that would mean hundreds of new infections missed by the tests and arriving each day. Maybe that's the best we can do, but it's not zero COVID. And it's not New Zealand, where everyone, they don't test you. You're not tested, and then if you're okay, you're released. Everyone is quarantined however you test. And third worry, the downsides of lockdown. the statement does say, and I'm sure it's right, that zero COVID doesn't want what they call crude police enforcement. I guess they mean something like what you had in Spain and France last year, where in each country there were over 1 million arrests in the first few weeks of lockdown. Something like 50 times the level you had here. But look, no government can enforce a lockdown without quite a lot of arrests. You can't. Again, we're not saying we're not against all police measures. What we do say is you can't just say you're locking down for as long as it takes and ignore the fact that takes a lot of police action. Again, about 2/3 of school students in the USA have now had no school or almost none for more or less a full year. And there's no end to that in sight. Lots of people in many countries have been unable to meet their friends and family for a very long time. Lots of people have lost jobs. If you're doing a lockdown in the real world, in the capital world, that is bound to happen. We can mitigate it for a short term if we can keep the labour movement a factor in the situation, but it will happen. So it's one thing to accept that lockdowns, even fairly strict lockdowns, are necessary for limited periods. It's another thing to make full-on lockdown, and I think for much longer than any country has, maybe not 4 years, but, a very long time, your central policy. The fourth worry is vaccines. Well, vaccines aren't the worry, they're a good thing. My worry is the zero COVID policy is written ignoring vaccines, although it's not as if it was written back last spring. It was written in November. Right. 2 points here. Firstly, socialists should have something to say about vaccine production and distribution. It shouldn't be, secondly, suppose, and it's not far-fetched, we don't know, the vaccines are pretty good at preventing serious illness and death, but reduce transmission only a little. So they don't get us anywhere near zero COVID. So after widespread vaccination, COVID is still around, but it has a lot fewer deaths than flu, for example. So people still get COVID, but very few die. In that scenario, do we really want to advocate that everything stays locked down? No schools, you can't visit your friends and so on, more or less indefinitely. When it's not going to save lives, all it's going to do is get your transmission down to zero. The fifth worry is the one that ties it all together, what the labour movement does. Right, in a full lockdown, evidently the labour movement does very little. Workers are stuck at home, there are no trade union meetings, no demonstrations, no workplace action, anything like that. You can get, and we did get in spring 2020, some collective refusals of unsafe areas in the few workplaces that are open. And those can and did win safety improvements there. They did win a measure of workers' control. But by definition, nothing happens anywhere else because, we're at home. By definition, the streets are in the hands of the police because they're the only people who are allowed to go there, except in emergencies. So an indefinite full lockdown means essentially the labour movement disperses and each of us from our homes through social media or something asks the government to control the virus. Now, some measure, right, again, I don't want to be glib, some measure of that is unavoidable given the reality. So there's some measure to which we have to rely on lobbying the government from a distance and hoping that, for example, the threat of losing votes when elections are held again will have some grip on them. We can't do anything about it. We can't demonstrate immediately, but if the government is seen to act irresponsibly, it will lose in elections. But we want as little as possible of that immobilization of the labour movement. For example, in anything less than a full-on surge of the virus, it is better to have school workers in schools winning measures like rotas, effective testing, PPE, extra buildings, better ventilation, things like that, than to have school workers sat at home and just hoping that the police will do a good job of stopping kids going out and socialising. That is a better alternative. In March 2020, we said, one of the first things we said is the labour movement must act as an essential service in a lockdown. So the labour movement still has to be out there making itself an active agent in the social measures needed in this pandemic, and still out there, even if there are lockdown rules, as there have been, saying that we shouldn't be there. Only the labour movement, the thing the labour movement can do, and only the labour movement can do, is win the social solidarity that we need to underpin mutual aid.